To fix your sciatic nerve, we really got to understand the anatomy, because what we're going to work on is getting that nerve to glide around. And it's important that we don't crush the nerve. We don't want to put pressure on it. We want to be all around it so that thing can glide around. So let's look at the anatomy. Right here, looking at the glute. So I'm going to pull this glute. This is the major glute muscle right here. We've got a cross pattern right here with our glute max, our gluteus medius. And so if we're looking at it, the sciatic nerve is coming out right through the glute right there. And so we don't want to be right here on our butt. Right? We're going to be digging all over that nerve. We want to work on the outside where muscles overlap. We look at this model, we have the same thing going on. That nerve is coming out right here and then dropping and going straight down the leg. And so I want to release the muscles that are going to be pushing on the nerve itself, pushing on the structures. If we look at the front of the spine, we have this psoas muscle. It's our largest hip flexor in the body. And so if our hips are tight and I lift my hip up, it actually pulls my back into extension. And extension is going to close down that space for where that nerve is coming through. And so we want to loosen up that area that's pulling and putting pressure on the nerve as it comes out and down into that sciatic notch. So it's coming back here and then it comes underneath these muscles in the glute. So we want to loosen up this ball of muscle on the side. We want to loosen up the muscle that's pulling on the spine from the front. And then we want to follow that nerve down the leg, loosen that up. Then we want to get it to glide. And then we want to do a movement pattern change so that those muscles don't take over and they don't get tight on us again. When we do that, it's a quick routine and it's a really thorough fix. We're going to actually be able to loosen that up. And if you do it consistently, you're going to get yourself out of sciatic nerve pain. Hit the subscribe button so you can get more videos on how we fix this stuff in the clinic. We're going to show you how to fix it from YouTube, from your home. First, we got to loosen up that hip flexor, the big hip flexor right here. So what I'm going to do is lay down. I want to get right here. This is my pelvis right here. And then I'm digging right in. You're not going to damage any organs staying off to the side. So we're pushing into that bone like a bowl. So I'm going to lay down right here, bend my knee, and I'm pushing out into that psoas muscle, and I just put pressure on it. Each one of these releases of muscles, I want you to hold for about a minute. So I'm digging down into this muscle right here, just gliding it a little bit, pointing out to the side. And so I'm loosening that up. If you don't really feel it right there, you should, but if you don't feel it, it should be a little bit tender. If you don't, you can lift this leg up and you'll feel that kick back out. You'll feel a lot more pressure. So we do 1 minute loosening up that hip flexor so we can take stress off the spine so that we're not being pulled into extension. Number two, we want to loosen up the glutes. So we were talking about how those muscles cross each other here on the outside of the glute. We want to stay off the middle of the glute. That's going to cause more irritation. So it's very specific that we're out here by the belt loop out on the outside. So what I'm going to do is lay down, and I don't want to put this ball underneath my butt because now I'm on the back of the butt right next to that nerve. I put it off to the side right here at my belt loop right there. And then I'm just going to glide over. I want to keep my rib cage stacked over my pelvis. And so my legs and my shoulder are going to reach over, and I'm digging down into that. Make sure you support your head, just resting. I can move this leg around, but now I'm feeling some good pressure right there. It's going to be difficult to do on the bed. It's best to do on your floor. But if you do want to do it on the bed, take a yoga mat, take a piece of wood, or take a towel. You can grab a towel, fold it up, and get a towel where it's thick, and you can take away some of that give that the bed has. We just need to loosen up this muscle. This should be tender right here, moving that leg around. And then if you don't feel it very good, this right here, putting my leg up and over, I'm staying stacked. This is where I really feel it a lot. And I'm loosening up that muscle in the glutes so it stops having that pull. We're getting a pull around and we're putting pressure on that nerve. I'm loosening that up. So I loosen up the front so the nerve can glide around from the roots, and then down right here where the nerve starts to spiral up, it starts to be a big piece of rope. I'm loosening up right here. Now we're going to go into the hamstring. In the hamstring, I want to be on the outside. So right in the middle of the hamstring, our sciatic nerve is going to run right there. So I'm going to be on each side of it. So I get back right here, put this ball right in the meat of the muscle, right here where my shorts are coming down. For me, it's about my hand length from my knee. And then I'm going to put pressure right here. Same thing. If this is shooting pain up or down the leg, then we're probably right on the nerve. We don't want to do that. That's going to cause more irritation. So I'm just pressing right here. It's tender, but it's not shooting pain anywhere. So I know I'm not on the nerve, and I'm just loosening up these muscles that are corkscrews. They're pulling on that sciatic nerve. That nerve, when we have sciatica, the nerve gets irritated and it starts misfiring, and muscles will clinch up, cinch up, grab that nerve to try to create stability, and that becomes the irritation that you can't escape. So if you really want to fix this, if you really want to start feeling better, we've got to loosen up the muscle tissue around it. So I'm just gliding my leg up like this, and I'm going to do 10 of them, and then so that takes about 30 seconds, and then I get to the inside. Same thing, I'm putting pressure right here. If I need more pressure, I'm going to put my hand on my femur, pressing down, and I don't need to come up all the way. This is gentle. We're going to do this routine 3 times a day to get out of sciatica pain. So we want to do it consistently. We don't want to beat ourselves up. I don't need to be extremely aggressive with myself. I just need to be consistent with this. So I do 10 swipes right here, and now I've loosened up that hamstring. So now I've knocked it out up here, I've knocked it out on the side, and I knocked it out on the hamstring. If it's going down into your lower leg, then we have something for that as well. So loosening up the calves is a little bit more difficult because we need to get into a unique position. Doing a foam roller with your calf or a lacrosse ball, we just don't have enough leverage. So we grab a rolling pin. If you have a rolling pin at home, a dough roller, that's okay. Like, it's gonna get the pressure that we need. And so when we do this, we put our leg up on a chair or on this table, and I'm just kneading into that muscle tissue in my calf. And I'm thinking about being on the outside and the inside, and I'm just gliding it around right here. So I need to get it inside my leg right here, and then I'm just gliding in. So I do 10 of them right here. I'm gonna do 10 of them down out to the side right here. And then I'm gonna do 10 on the inside, so I need to get it back in there. 10 on the inside, loosening that up, and then 10 on the inside down a little bit lower, and then I can glide right here. So about a minute, just loosening up that tissue. That's gonna release the nerve all the way down. We call it at the clinic, we call it following the nerve. We'll do it with our hands. So if you have a spouse that's willing to get in there and start loosening up tissue, that's absolutely something that I would utilize. Most of your spouses want you to feel better. So they can get in there and dig out that tissue just the same as this, but this is a really good alternative just to loosen up that tissue. Now we've loosened up all the tissue, all the muscle tissue and connective tissue around the sciatic nerve. Now we want to lengthen and we want to have it glide. And so this is a PNF stretch. And so I'm laying down to the side, I roll back. What I'm going to do is just straighten this leg out a little bit. If you have pain with your legs straight like this, it just means that your butt is pressing down into the table or into the bed or the floor, and that's causing your back to go into extension. So we know that that extension pull is happening inside the body. So what I'm gonna do is not put my back into extension. This should relieve it by just keeping one leg up. And then I'm gonna take that other leg, I move them one at a time, and I'm gonna come across right here. And then I'm gonna pull this knee towards my opposite shoulder. So I'm pulling over towards the opposite shoulder and maintaining that. I feel a good stretch, but I'm not pulling my butt up. So my butt shouldn't come off. That would be doing a low back stretch. So I just wanna stretch out of this glute. So we loosen up the glute muscles so that that nerve can glide around. I'm pulling over to the side, and I'm gonna do a 10-second hold. And then I'm gonna actually push with my leg over, resisting it with my hands, and then I'm gonna come back. So it's a 5-second hold. So it's a 10-second hold into the stretch, a 5-second hold pushing back, and then a 10-second hold into the stretch, then a 5-second hold pushing back, just letting it go just a little bit. I'm gonna do 5 of those, and then I'm gonna switch sides, bringing it up and across. We always do bilaterally, because if one glute is really tight, then the other glute is gonna be tight as well. So we need to attack both sides. It's better to do everything on both sides so you get the same looseness and decrease in pressure on both sides of the body. So I'm pulling across right here. Just breathe and relax. We also see a lot of clients that they hold their breath, and so it's really hard to relax and get the nerve and the muscles to glide around effectively if we're holding our breath. I'd do a 5-second push going back, and then I'm coming back down. So I'm just feeling for that stretch, and I'm gonna do 5 of those. So now I've gotten the nerve to glide around. Now we need to have a movement pattern and exercise and standing to really get it to set in. Now, the last exercise in our routine, we need to do a hip hinge. We need to get that nerve gliding around through the chain. So we've got to use the muscles on the back side of the body, and we need to keep our spine in a neutral position. So what I'm gonna do is I'm gonna step out. So right here, I can do it on a wall, I can do it on this table or your countertop, about your foot length away from it. So I'm gonna measure my foot length away, where my toes are in my shoe, and we start from a shorter position. So that's pretty far back. I'm gonna scoot back just a little bit. I don't need to go really far with this. I just need to make sure that my spine is in a neutral position and I'm engaging these hamstrings and glutes. I'm coming back right here, coming back up. I'm gonna even get a little bit closer so you can see it's the same motion coming right here as this motion coming down. I just go down a little bit further into that position. So, but I'm always keeping the same position. So I'm reaching back and coming back up, nice and slow. I'm going a little bit too fast, nice and slow, keeping that neutral position. So think about, you got a rod pressed through the top of your head, it's coming out your butt. There's gonna be no change in angles of my spine. So I'm coming right here, pushing back and coming back up. And it's almost like somebody is pulling on the back of your shorts. They're pulling you back, you're coming back up. My lower leg is vertical. So it's like a stake. I drove it in the ground. I'm going camping. I got stakes everywhere. I'm driving these stakes down here, straight down, my knees bending, but my hips are leading the motion. And I'm just engaging that. I had a client that came in, she just rolled out these areas, and then she did 10 hip hinges, and she did it 3 times in the morning the day after she tweaked herself. She came back in and told us, hey, whatever you told me to do, it fixed it. So that's the power of doing this routine, is that you can actually fix your own sciatic nerve problem, and we know that it works. I need you to do this routine 3 times a day for 2 weeks to get yourself out of pain. We need to be consistent. Remember, stay off the nerve. If we're on the nerve and we're causing shooting pain up or down the nerve, then we're causing more problems. So we're irritating and we're gonna make it worse. So we need to be around in the muscle areas here on the outsides of the hamstring, and then in the calf, you can just run on the inside and the outside just like that. We loosened it up. We got that nerve to glide with our stretch, and then we did our hip hinge, and we're gonna do 30 reps of that. If you're doing it really good, you're gonna feel it in your hamstrings, and then after about 2 weeks of doing it consistently, your glutes will fire up. So stay off the nerve, but grind out and loosen up that tissue. Remember, when you're doing the stretches, it's not about overstretching. We just need to glide. When we have sciatica, we're looking for that nerve to glide around through the tissue. Do that consistently, you're gonna be able to fix your pain. We'll see you in the next video. Get mobile and stay active.